Welcome to the Unleashed Performance Therapy Podcast. I am your host, Robert, here with my co-host, Jamie. And today we have one of my longtime friends and former employees, Dr. Christina Ramirez, DPT. She is a clinical orthopedic specialist and is certified in master dry needling. Hi, Christina. How's it going?
Hello, RJ. Hello, Jamie. Thanks for having me on.
No problem, no problem. Um, let's just get started. Give us a little intro, how you got into PT and all that good stuff.
Sure. So, I got into physical therapy because I went to college. I knew I wanted to be in healthcare. I knew I wanted to do a job where I spent a lot of time with my patients. I got to know them on a personal level. I got to be a really part of their life, watch them go from bad to better. And originally, I went to school to be a pharmacist. Thankfully, after shadowing for that, realized that's not really my cup of tea. And got led to the physical therapy profession. And it was honestly everything that I just said. I just didn't know that that's what I wanted. So it was really, really great that my counselors were able to guide me to that, and did shadowing, of course, for physical therapy. Absolutely loved it. Got into school at UT Health now in San Antonio is what it's
Okay.
called. Yeah. And then when I graduated, I stuck with outpatient orthopedics, worked in Georgetown for 3 months, moved to New York City for 4.5 years.
Ooh.
Yes, worked in outpatients there, and also worked at Broadway plays on the side doing therapy for their performers.
Oh, wow.
And then when I moved back here, did outpatient ortho again, and just recently opened up my own practice with my partner, Dr. Cameron Burney. So it's been
Nice,
an
nice.
exciting journey. Yeah.
Exciting for sure. Yeah, I didn't know about the New York and the Broadway stuff. We might have to touch on that as well. So
Yeah.
definitely gonna talk to you about a couple different sporting events, stuff like that, and even the Broadway. We could throw that in there. But main thing that I want to talk about is body mechanics. So again, we are as physical therapists, we are movement experts, and just what do you see when you're treating patients? What's the main concern? So for these higher level patients and people like returning to sports, what's the main concern that they have when it comes to body mechanics, you think?
Sure. So, just to talk a little bit about why body mechanics is so important to physical therapy. As I'm growing my own practice, I'm having to do a lot of differentiating of my practice compared to people that might normally be compared to physical therapists, such as chiropractors, such as massage therapists, such as personal trainers, right? And how are we different than that? What do we provide that's different, right? And one big key thing I've stuck on is body mechanics, because the massage therapist is going to help to relieve your pain, right? The personal trainer is going to help you to build strength. The chiropractor may analyze your posture and analyze your how you look and observe, and then they're going to fix that. But none of those people really watch you, how you move, doing the activity that you want to be able to do, and analyze that the same way that a physical therapist does.
Mm-hmm.
I was talking to someone recently about the fact that in physical therapy, when you want to go to physical therapy school, physics is a big portion of the curriculum to get into physical therapy school. And so when I am looking at someone's body mechanics, I am really looking at the physics of how their body is moving. I'm looking at the different levers, the arms of the levers, the hinge points, the fulcrums, and, deciding, are they using that body part in the most efficient way to get out of that activity what they want to get out of it. So body mechanics applies to so many things. Of course, a lot of people think about it when it comes to lifting, right? If you have a job where you lift a lot,
Mm-hmm.
or you're a new parent or a new grandparent, you're going to be lifting that baby a lot. You're thinking about your lifting mechanics, right? But even how we get out of a chair, it needs to be trained to use the right body mechanics. In my practice, my partner and I, we specialize in looking at runners and tennis pickleball players and golfers. Those are the four groups of people that we really like to analyze their movement. And so if they went to another provider, they may get an analysis of their walk, they may get an analysis of their run, but it's not going to be the same depth that a physical therapist is going to look at it, or from the same perspective. And then we're going to also look at, as you're playing that sport, as you're doing that activity on the surface in the location that you normally do it, how do you look when you do that? I will mention that my practice is mobile. So we come to our clients, and being able to see them in their environments makes a huge difference in educating them on those body mechanics and how to use them
Mm-hmm.
properly in their environment.
Nice, nice.
Absolutely. I was gonna say, I think that with you being a mobile therapist, mobile company, I think those sports specifically are really good to be in that business because you can go to a pickleball court, you can go to a golf course, you can watch them play, and then it's not only the body mechanics that you're looking at, you're also looking at the biomechanics to improve their swing, to improve um, different movements that they're doing to optimize their performance. Um, so, as far as optimizing performance with like rotational sports like pickleball, baseball, golf, what are some of the most common things that you see and that you try to quote unquote fix for people with those rotational movements?
Yeah, so I will say, some common injuries that go across the line with rotational sports, because of course each of those are going to come with their own common injuries. So one of the biggest ones that crosses all of those lines is, of course, back pain, right? Because with those rotational sports, people may be used to bending over, coming back up, moving from a sit to stand, doing things like that, but they don't rotate a lot, and they only do it during the sport. So a
Mm-hmm.
big thing that we look at there is not just rotation in your lumbar spine, but movement in your thoracic spine. A lot of people tend to forget about that needing to move. And as physical therapists, we know that the majority of your rotation actually comes from your thoracic spine, whereas your side bending comes from your lumbar spine.
Mm-hmm.
But when you see people move, they tend to rotate from their lumbar, from their hips, rather than wanting to move from that thoracic. So improving movement in just that thoracic area can make a huge difference in their pain that they experience if they can move throughout the whole spine rather than continuing to move from the one spot that they always move from. So that's a huge one that crosses all of those sports. And the way we work on it, like I said, is working on the thoracic mobility and, working on core stability as well. And when we're doing the exercises, we're making sure to prescribe exercises that the person can perform correctly and get the most benefit out of, rather than giving them a more challenging one that they may not be doing correctly, and then they're not going to be getting all the benefit out of it that they could.
Yeah. And improving mobility, I think I harp on my patients a lot with mobility, improving mobility, but I also want them to know that we've got to be mobile, but we need to be strong in all those different areas. We can't just move through in range and not expect to have to do something in that in range. So it's
Right.
very important to build strength in those throughout each moment of that movement.
Definitely, definitely. Kind of like, if we were to say, okay, what's another common injury with golfers and pickleball players? Well, shoulder injury, right? Rotator cuff
Mm-hmm.
irritation. And like you said, you need to strengthen throughout the whole movement. So you can't just strengthen with the arm down by the side. You've got to strengthen with the arm overhead as well, and make sure that body mechanics, the person is raising their arm over their head correctly without compensating with incorrect muscles or compensating with their shoulder blade moving more than it needs to. So I 100% agree that working on strength through the whole range is important.
So getting specific with this pickleball stuff, I have not hopped on the train, the pickleball train, because I hear about it multiple times a day, all day at work, stuff like that.
You got to get on it.
Regardless the age, the first time I was exposed to pickleball was years ago, years before COVID as well.
Yeah.
We were me and some friends playing basketball at
Yeah.
this like a civic center. We got kicked off the court by these 80-year-old ladies with their
Oh,
little paddles in
nice.
their net. And I was like, this is a miniature tennis. And I do not know what's going on. These old ladies, there's no way they're about to play this game. And they're up and down the court playing the game. And it's funny,
Yeah.
I had a previous boss, his one of his family members, they finally retired. So they bought this RV. They had these aspirations to go to every national park. They were going to do this big trip. He said the first park they went to, there was a pickleball court, and they were there for about 5 days to a week, and they never left. They never saw the park or anything. They were just playing pickleball.
Wow. Oh my
So is
gosh.
is there a big difference from pickleball and tennis?
It's time, man. You got to get on it.
I'm gonna just have to figure it out. Huh? Just dive in.
Well, I know that Jamie said before we started that he also likes to play pickleball. So I'll let him chime in as well if I don't cover anything that's different. But I think one of
Sell
the
it to me.
biggest, yeah, I think one of the biggest differences is that the court is smaller, right? So you have to cover less space. So that's a huge difference. And then, outside of that, the equipment that you use is lighter. The ball itself does not bounce as hard or as far, so even the ball can slow down a little bit in the air, so you're not getting injured by getting hit by really hard spikes, or injuring yourself by trying to return a really fast moving ball. So those are two huge differences, I think, in why people gravitate towards pickleball when they want to find a sport that they can play for longer, and maybe not have to be in such tip top shape like a tennis player might be.
Okay, okay. All right, you're working on it, pushing me a little towards it. So I might have to check it out. I might have to check it out.
It's
I
All
fun.
also
right.
It's fun.
think, yeah, I also think that it's a really social sport. So when you said that the ex
Oh, big time.
boss's, cousin, you said it was cousin or wife went,
A
or
family
neighbor,
member, yeah.
family member, and I think a huge thing about like them not leaving the court is it's very social. When you go and play pickleball, people want to get to know each other, and it's competitive, but I've played with people who are way, way, way above my level, and they are just so patient and so sweet. And maybe I'm just meeting like really great people, but I do feel like the pickleball community is a bit more inclusive of people of all levels, and they want, just to get to know you and have fun versus, make you feel ashamed at your skill level.
All right. Kind of changing it up a little bit. We actually we're planning on having Dr. Cameron on talk about golf. So we'll switch the sports up a little bit. Let's talk about the running. So of course, ultimately, you have people that you see, your clientele that you see.
Hmm.
Maybe they have been injured, so you're helping them with that. But ultimately, as a therapist, you want to educate a patient to prevent the injury. So when it comes to your runners, how do you optimize their performance and try to avoid or decrease the injuries that they do come across?
Sure. So, one big difference between running and, let's say, a sport like pickleball or tennis is that a lot of running is done in a single plane of motion. Okay. So, if you looked at someone's body and you divided them from left to right, then you would be looking at their sagittal plane of motion. If you divided them from front to back, you'd be looking at their frontal plane of motion. And if you divided them in half, top and bottom, you'd be looking at their transverse plane. With running, we mostly only move in our sagittal plane. It's just a forward backward movement, right? Mostly forward, not backwards so much. But there's not a whole lot of side to side movement with running. With pickleball, tennis, there is more side to side movement. So you will see other injuries, but the fact that you do go in all directions with pickleball or tennis, it can actually be really great for your joints because it balances you out and it keeps you strong in all different directions. With running, because you're only staying strong in one direction, the biggest thing I always do with runners is look at their strength in their frontal plane of motion. How do their hip abductors look and their hip adductors look strength wise? Because when we run, when we walk, when we stand, people often end up with hip pain on the side, or knee pain on the side, or ankle pain on the side from those muscles being weak and not being able to stabilize them as they land on that leg, running, walking, or shift weight onto that leg while standing. Think about it as, instead of, when someone pops their hip out, like they're giving you a little bit of attitude. If you think about it instead, like they're allowing that hip to collapse, they are not actively using their muscles at that time. And when you allow for that active collapse to happen, you can imagine that doesn't feel good on your joints or on your tissues surrounding that joint. So I definitely work with them on stabilizing those lateral motions. And then I work with them on coordinating how they should be using their muscles and during what part of the run phase, right? Should you engage those muscles more as you land? Should you engage them more as you're pushing off? Should you engage them more as your leg is swinging through? When should I be thinking about engaging those? So that's something else I work with them on, is not just strengthening, but how to use those muscles in the actual movement. At what points during the movement are you going to use those muscles?
So one thing that we talked about earlier, dry needling,
Mm-hmm.
and that's kind of a I don't want to say it's really new on the scene, but it's starting to kind of pick up in a lot more practices in different settings and stuff like that. Um, for our listeners, a quick breakdown because of course people see the needles and they first thing they ask is that acupuncture. So
Right.
real quick, could you explain the difference between acupuncture and dry needling?
Of course, it's a question I get all the time, and we even have it on our website as a free handout to people, a dry needling information sheet. So when we give our website at the end, make sure to go and check that out for a free handout on what is dry needling, why do we do it, what's the difference between acupuncture and dry needling. But basically, in a nutshell, and I'm not an acupuncturist, so I don't, plan to speak for them. I probably don't explain things the same way that they would, but as my understanding is that an acupuncturist is going to be looking at balancing your chi, okay, and also putting needles in along your meridian lines in order to balance that chi. Their purpose is a lot more systemic, wanting to affect your whole body. So they might work on things such as stress or anxiety, or helping you quit a bad habit, or helping you with, if you have infertility issues, or, just overall weight loss issues, they can help with those systemic things, right? Dry needling is only neuromuscular treatment. Okay, so we're helping with nerve pain, we're helping with muscular pain, we're helping with joint pain, but we are not helping with pain being caused by your kidney function, or your IBS that's bothering your GI tract. We are not helping with that. That's not our forte. So when I do the dry needling, I am basing it on what I palpate. And palpation, of course, is just a fancy way of saying what I feel with my hands, right? So I place my hands on the person, I'm feeling around the area that they're complaining of the pain. I feel changes in the tissue. So I'm going to insert that needle into the areas that I feel like are going to be the tightest, okay?
Right.
Basically, to distract your brain from the pain that you are in from that tightness. It is a stimulus that gets to the brain faster than the stimulus of just muscle achy pain. So
Mhm.
once the muscle achy pain nerve signal gets to the brain says to the body, I can't even listen to what you're telling me right now, because all I'm thinking about is that there is a needle in me. So that then allows that muscle to let go and relax, because it's not getting the feedback from the brain to stay tight at that point. The brain has said, I'm not talking to you right now. So the muscle says, all right, if you're not going to talk to me, then I'm going to let go. So that's kind of in a nutshell what we do with dry needling, but it can help with basically swelling around a joint or an injury. It can help with old scar tissue, no matter how old it is. It can help improve your range of motion, decrease your pain, and improve your mobility. So there's a lot of benefits to using it for treatment, whatever your injury may be.
Now, you personally, do you incorporate that into all your treatments, or is it a certain presentation that patients give you that you, of course, your palpation, but do you do it every patient?
So it depends on the patient, right? So, first and foremost, if they have a major fear of needles and they're just not going to get past that, there's really no point in me dry needling in them at that point, because the point of dry needling is to get you to help relax your tissue. And if you are inadvertently tensing because you're so scared of the needle, it's not going to help. So I might as well not do it, right? And
Yeah,
and
right.
then you're not going to like me anyways, and you're not going to want me to come back. So that doesn't benefit you or me. um, but I do definitely tell folks if they're like, I need to get better as quickly as possible, I will do whatever. I'm like, well, if you want to get better as quickly as possible, dry needling is the way to go. I find that I can get people better in a fraction of the number of visits when I include dry needling in their plan of care. Now, I don't do it every session. I use it for as long as it's needed, and then we move on, because just like any modality, I don't want you to be dependent on it. I want you to be independent and be able to manage your symptoms on your own without needing me to put a needle in you. I will be here for you if you cannot, but I want to educate you so you can take care of yourself.
Nice, nice. And I've definitely learned over the years there's definitely different techniques to the dry needling. Of course, you attack certain things a certain way. You have a certain style, if you want to say, that a therapist uses opposed to another, and you
Right,
just kind of have to investigate, figure out what works best for that patient and your treatment.
right.
Now, your practice, elevated PT.
Yes.
Now, you guys focus on, like you said, the golfers, the runners, pickleball, tennis,
Hmm.
those particular sports. Now, did you guys start with the idea that you wanted to kind of cater to that clientele, or was it more of you just starting to practice and just kind of getting your feet wet?
So honestly, we did not start with that being our goal of working with just those populations. And even though we do advertise that that's who we specialize in, we do still treat tons of other people. So I'll just throw that out there. But what we started out as was basically we just wanted to provide a better service. Like I said, we are mobile. We are also mostly cash based. Reason for that being not to go down a whole rabbit hole, but insurance companies are actively decreasing reimbursement for physical therapy every single year, whereas the world is increasing costs of living, costs of owning a business every single year as well. So the one way that most physical therapy clinics combat that is by having you see more patients in a day in order to make up for that lack of reimbursement. um,
Hmm.
it just got to a point that Dr. Cameron and I just felt like we were no longer able to provide the level of care that we wanted to provide. And we were also getting burned out ourselves from providing even not the level of care that we wanted to provide. So at this point, we were just like, we're just going to cut out the middleman. We are done dealing with insurance and all the red tape that comes with it. We're done dealing with the visit limitations, the having to argue with, peer to peer reviews about why a patient needs therapy. um, we just want to get back to basics and treat patients for as long as they need to be treated, really personal treatment, and you know just show people what physical therapy really can do versus people saying all the time, oh, I had failed therapy. And you get into the nitty gritty of the story and you're like, oh, well, you didn't have failed therapy. Your therapist just wasn't able to treat you because they were seeing, 2 to 3 other patients at the same time.
Hmm.
Um, so it's we're on a mission, one to just kind of change the people's view of healthcare and what it can be when we get back to basics of just a provider treating a person versus working through an insurance company to treat that person. So we started with that mission. And then we said, okay, well, we really like working with active people, adults of any age who want to be active, the kind of people that are like, I want to be able to go for a walk every day to maintain my health. I want to be able to go hike in Colorado next week. I want to be able to run this race. I want to be able to golf in this tournament. I want to be able to pick up my grandkids and play with them and get down on the floor and get back up and not feel like I have to just sit and watch them on the couch.
Right,
Um,
right.
to us, making those small changes in people's lives just makes our job worth it, right? That's why we got into this profession, was to help people improve their quality of life. So at first we said, well, we just want people to understand that they can have fun at any age, that arthritis, that old age does not hinder you from enjoying your life. It's your activity level, and let's get you more active. Um, but with that messaging, we weren't necessarily seeing any of the younger population, like people my age, right, in their 30s, who are also starting to go through that transition of, oh, my body doesn't work the same way that it used to. I don't heal as quickly as I used to. I don't wake up bouncing out of bed like I used to. We're just starting to realize that. And I want to be able to help people at that age, like you said earlier, to prevent the pain from getting worse. So that's when we started saying, we want to help active adults stay active, people who are already active and they want to stay active. That's their goal. Um, I am a runner myself. I started running in college and have done anything from a 5K all the way up to full marathons. And so, I enjoy working with that population because I understand them. I understand what they're going through. I understand what pains they're having. I understand how to get rid of it. For the same reason, my partner, Dr. Cameron, is a golfer. She feels the same way about that population. And then recently I started getting into pickleball, and I've played tennis in the past, so I was like, this is a really fun sport and this is growing a lot, and this is the exact kind of person we want to work with, someone who's active and social and outgoing. So I really want to work with these people too. So that's kind of how we landed on those groups.
It
Gotcha.
sounds
That's a
like y'all have
major.
a good. It sounds like you have a good pairing, you and your business partner.
We
Um,
do.
I think that that's more of a common mindset now with new PTs and PTs that are coming in straight out of school. You know, they see that the insurance based models are just terrible, man. It's you're too busy to take care of people the way that you want to be able to treat them, and I feel like there's a lot that you can do, and you just don't have the time with the person one on
Mm-hmm.
one, so you can't do
Mm-hmm.
it. And you kind of explained the way that you explained it is has a lot. It's very similar to the mission statement of the APTA. It's
Mm-hmm.
I pulled it up because I couldn't remember exactly what it was, but it's transforming society by optimizing movement to improve the human experience, and that's
Mm-hmm.
exactly what you said. I mean, it's not exactly, it's a paraphrase of what
Right.
you said. So we're optimizing movement to improve the human experience, and that human experience can be anything from playing with your grandkids, going for a walk, going for a long hike, and it's freedom. Freedom
Mm-hmm.
to do what you want when you want. If somebody asks you, "Hey, do you want to run this 5K this weekend?" and you haven't trained for it, yeah, I can. Because I don't have to get ready, right?
Right.
Because you got to you stay ready so you don't have to get ready.
There you
Right,
go.
right. And I'll say,
Um,
I bet you can relate, Jamie, that, as parents of young children, they're just getting heavier every
oh
day.
yeah, it's
And they
nuts.
still want to be carried, and they still want to, want you to run after them and keep up with them. So, at one point I worked out in my life because I wanted to look good, right? I wanted to look like I was
Hmm.
fit and in shape. And now I'm just like, I'm working out because my kids are just putting on weight every single day, and I want to be able to carry them for as long as possible.
I can't remember who said it, but recently I heard a video said, "Don't. I'm not working out so I can look good. I'm working out so I don't. I can beat my kid at a foot race
Yes.
for as long as possible."
Yes.
That's the important thing.
Yes.
Oh, kind of backtracking a
Yes.
little bit to the business part of things. You said that y'all are mostly cash based. What
Yes.
types of insurances do y'all take?
So the only insurance that we do take is traditional Medicare,
Okay.
not Medicare Advantage plans. We don't take those. We
Mm-hmm.
take traditional Medicare. However, what we do offer to anyone with any insurance status is if your insurance has out of network benefits, we will provide you with a super bill, which is, just a fancy way of saying a receipt with the special codes on there that your insurance needs to know what we're charging for. And we will give that to you, and you can turn it into your insurance, and they may either reimburse you some of the money, or
Mm-hmm.
put the money towards your deductible, at least, or they may not reimburse you at all. We don't guarantee that they'll reimburse you. We don't guarantee how much they will reimburse you, but it's an option for folks.
Okay, yeah, I was very curious about that because I plan to attempt to open up my start my own practice, and
Yeah.
bouncing back and forth between the insurances and the cash based, and
Mm-hmm.
if I do a hybrid plan, what insurance
Mm-hmm.
should I take? Um, and I was thinking about doing the Medicare. Well, I mean,
Mm-hmm.
it's this is gonna be way far in the future. But if at the moment, if I were to open up my practice today, it would probably be Medicare. And
Right.
what are some disadvantages to plans like Blue Cross Blue Shield? Do you have any that you can think of?
I would say one huge disadvantage, and this comes with Medicare secondaries as well, is you're not getting paid for 3 months after you
Oh,
provided the
okay.
service. So you're doing
Mm-hmm.
this service and then you're waiting months to get paid, which is really hard at the beginning when you're putting a lot of work into
Absolutely.
growing a business and you're not making that money.
Mm-hmm.
Other issues is, Blue Cross Blue Shield really doesn't sit there and limit. You don't have to write, uh, reports every several sessions to justify why you're seeing them, kind of like Cigna does. There's not a whole lot of visit limitations like other insurances will. Aetna will say things like, we will reimburse you only one set amount. We don't care how many times
Mm-hmm.
you see the patient. You could see him 5 times, you could see him 500 times. We will only pay you this set amount for however many visits. But Blue Cross Blue Shield, I'd say the biggest thing with them would just be if you end up having to do a peer to peer, or just the fact that they're going to keep switching up the codes on you and saying, well, we reimburse for this but we don't reimburse for that, and if you
Yeah.
charge two of this, we'll decrease the second charge, we'll decrease how much we'll pay you for the second charge, but if you charge
Mm-hmm.
this instead, then we'll, it's just playing games, it's playing
Yeah, that's
games.
the bad part. And
Yeah.
there are those insurances. From when I worked in outpatient as a PTA, we were kind of educated loosely on which insurances would reimburse for 1 unit or only 2 units, or like
Right.
Blue Cross Blue Shield. You can bill for them working with a student um, or a tech. Uh,
Right.
and then there were only two insurances that were reimbursing for dry needling when I was an outpatient. I don't know if that's
Mm-hmm.
changed, but one of
Mm-hmm.
them was Blue Cross Blue Shield Health
Mm-hmm.
Select, and then
Mm-hmm.
the other one was the VA. So I
Mm.
wasn't sure if there was just some other reasons why it was only Medicare or traditional Medicare, which I've heard from multiple people that don't let your family get on anything else but traditional Medicare.
Agreed. Agreed. Do not let your family go on any of these Medicare Advantage plans. They're basically like going on an HMO plan versus the PPO plan that you get with Medicare. So only traditional Medicare. That's the way to go. Um, I we belong to a networking group as part of our growing our business, and there are several insurance agents that are part of that, and one of them is a Medicare specialist. So we're always asking her questions about how do we educate patients on this or that. I think another way that we set ourselves apart for our patients is that we're not just their therapists, we're resources to them for their health and wellness questions throughout the community. We know who to send them to, what specialists are going to know more about that. But as far as a therapist, I would say Medicare is the easiest one to send claims to and get reimbursement from. Uh, Usually takes up to 2 weeks for you to get payment from Medicare, but then it takes, like I said, 3 months for you to get payment from their secondaries. So, um, I think that our ultimate goal is someday we, may only do cash pay, but we'll just have to see how things keep going.
Wrapping all that together, so um, showing your patients that they have those options, little things like providing that super bill, letting them know or giving advice on what you think is better for them. And then going to, you're a runner, Cameron's a golfer, so you can kind of empathize with those patients. That's making it more personable, more personalized care. And it seems like Elevated PT, there you got the whole package and everything's good. Is there anything that you guys are looking for or looking forward to in the future? Expanding, anything like that?
Yeah, one other way that we do help our clients, that we do provide that higher quality care, is also that we are open to messaging with our clients 24/7. Now, if you message me at 2 o'clock in the morning, I'm not going to get back to you right away. Nobody has done that, but I let them know that. But we promise to get back to them within 24 hours. So, like I said, with seeing less patients on your docket at a time, you're able to provide that higher quality care, really be there for your patients, and we get them better so much faster in less than half the time that it took us at a regular clinic. So it's been really, really great. And, the way that we'd like to grow it is, we'd like to grow it someday to include other therapists and provide a work environment for therapists where they're not going to get burned out. Our goal is to see 20 visits in a week, not 20 patients, 20 visits in a
Oh,
week.
wow.
And past that, we're just doing admin work. We're working on being there for our clients and being there for the community and reaching out to the people in our community that we think we could provide a free workshop for. Um, we want to provide that as an option for other therapists to become specialists in the field that they want to be specialists in and not get burned out at the same time. And then, like I said, promoting the field of physical therapy through that, having more providers that are providing this high quality care, and people will start to know that physical therapy are the specialists of the neuromuscular system. And hopefully someday we get direct access, full direct access in Texas, where we can again really push that we are the neuromuscular experts when it comes to movement analysis. So we'd love to do that. Eventually we'd love to even have some programs where we do community service, traveling to internationally to provide free medical care. We'd love to offer pro bono to some patients in the future, to provide that high quality care for people who maybe don't necessarily have access to that so easily. So really, I think that we're just on a mission to change the healthcare in general, and change the lives of our patients.
Nice, and I've definitely enjoyed following you guys' journey from even when we all work together, and then when you guys open your clinic, and to your social media videos and stuff like that.
Yeah.
Are you guys just local there, like Galveston County, or
Mm-hmm.
do you have a certain kind of
Yeah.
jurisdiction, if you will?
We do. We tell people that our usual radius, now we will go outside of the radius, after discussing maybe some gas pricing and timing pricing. But our usual radius, we say, covers the 4 Bs of Houston. So we go from the beach to the Beltway, from the Bay to Brazoria County.
Nice, nice.
I'm gonna
It's a
put that
nice
on a
little
t-shirt.
square,
Yeah.
yeah. There you go. Elevated PT, the bees. I got
Yes.
you. Nice.
The killer bees are
The killer
back.
bees. Here we go. Let's go, Strohs. Nice, nice. Before we go, Christina, we always
Hmm.
we kind of hit our guests with a little gym, kind of catch them off guard a little bit. This one
Okay.
won't be too bad. So,
Okay.
younger Christina going through PT school. If
Okay.
you could give yourself advice, any advice,
Hmm.
what would it be?
Um, Younger Christina going through PT school, I would say you have confidence in what you're learning. Have confidence in yourself, in what you're doing, because I was not a tech before PT school. A lot of people in my class were, so they knew a lot more than I did, and I definitely was intimidated by that. So I would say have confidence in the level of care that you provide. I would also say don't be afraid to start your own business, because when I was in PT school, I was dead set on I will never own my own business. I will only work for someone else. I don't want all that stress and headache. And I would tell myself, listen to the advice that your dad gave you a long time ago that got you into physical therapy over another medical profession, which was, Christina, you like to be the boss. You don't like somebody to tell you what to do. So keep that in mind. And I would tell myself, don't be afraid to start a business, because you're going to change the healthcare world by doing that.
Nice. I like that. I like that. So where can the people find you online and all
Yeah.
the social medias and whatnot?
Yeah. So our handle for everything is Elevated PT Wellness. So that is our website. Just add .com at the end. That is our email. Add @gmail at the end. That is our Instagram, Facebook, TikTok, YouTube channel. All of it is Elevated PT Wellness.
All right. Definitely get you out there. We'll be definitely in contact with you again when we do our dry needling series. We'll have a couple of our couple of our previous guests on, and we'll start that little series. And we
Great.
appreciate you hanging out with us. I appreciate Jamie toughing through what he's going through for
Yeah.
getting it
Yeah.
done.
I
He's a
know.
trooper.
Yeah.
He's a trooper. And that's gonna do it for this episode of Unleashed Performance Therapy Podcast. If there's any topics that anybody wants to talk about, or any special guests you want us to have on the show, go ahead and hit us up in a DM on IG, or hit us up on unleash.tx. Like Jamie always says, be sweet to us. Scroll down to the bottom, leave us a 5-star review, like, subscribe, do all that good stuff. And thanks for hanging out with us.
Thank you, Christina.
Thank you.